This lecture will cover MRI artifacts. The objectives for this lecture are to summarize most common MRI artifacts seen in the clinical setting, explain what causes each artifact, state the axis each artifact streaks across, describe the appearance of each artifact, discuss remedies or compensations for each artifact. Some important takeaways about MRI artifacts before we begin. All MR images have artifacts to some extent. Some artifacts degrade the image and may mask or even mimic pathology. Therefore, it is very important to understand their causes and how to compensate for them. Unfortunately, some artifacts are irreversible and can only be reduced rather than eliminated. However, others can be avoided altogether. This is what separates the great MR techs from the average MR techs. Motion artifact, aka phase mismapping or ghosting. Motion artifact occurs when anatomy has moved during the time delay between the phase encoding step and the readout gradient being activated. The phase encoding step has a different amplitude every TR, therefore anatomy moves during the scan and it is misplaced in the phase encoding direction as the phase gradient changes. So the axis this artifact streaks across is the phase direction. The appearance of this artifact are replications of moving anatomy across the image. Some examples are respiration, as you can see the chest wall streaking across the image in the phase encoding direction. You could have blood or CSF flow through the slice, as you can see on the image to the right. You have the abdominal aorta streaking across the image in the phase direction. You might have swallowing artifact that is prevalent on sagittal C-spine images, eye movement that is prevalent on an axial brain, peristalsis that you might see in abdominal imaging, and heart beating for any cardiac or thoracic imaging. And then the patient might be moving voluntarily because they are in pain, or they might not be able to hold still for the entirety of the exam. Some remedies or compensations for motion artifact. First, you can increase the patient comfort by providing sponges, blankets, medication if necessary. You can immobilize the part using straps, sponges, proper coils, things like that. You could swap the phase and frequency direction. This will not eliminate the artifact, but it might remove it from the region of interest. You can place a saturation band over moving anatomy. The image to the right shows a saturation band above the field of view, which will help compensate for flowing blood into the field of view. You might have a saturation band within the field of view, which will help reduce motion from, say, peristalsis in the bow. You can activate gradient moment nulling or flow compensation. This is just a bipolar gradient system to put flowing spins back in phase with stationary spins. You can select either in-plane or frequency mode or through-plane or slice mode. In-plane or frequency mode helps to compensate for motion along the frequency axis, whereas through-plane or slice mode helps to compensate for motion along the slice direction. You can also use respiratory compensation like bellows or the respiratory navigator. Bellows are a little outdated and a lot of scanners now have sensors within the table. You can use radial case-based filling methods like propeller or blade, which compensates for motion by filling case base in this spiral fashion. And then you can use cardiac gating for any cardiac exams. And finally, you can increase the number of signal averages or number of excitations to help average out the noise from motion. Unfortunately, if you select this option, increasing your next will also increase your scan time because next is incorporated in the scan time equation. Wraparound artifact, aka aliasing. This artifact occurs when anatomy outside the field of view still provides a signal if it is in close proximity to the receiver coil. Data from signal must be encoded, i.e. allocated a pixel position. If data is undersampled, signal wraps into pixels within the field of view rather than outside the field of view. This occurs in the phase direction because you have duplication of phase values. Spins outside the field of view have the same phase position as spins inside the field of view, and so they wrap inside because they have the exact same phase value. This typically occurs on the opposite side of the field of view, so you can see from the image to the right that the right hip usually projects on the left side of the field of view. This artifact appears as anatomy outside the field of view is folded on top of anatomy inside the field of view. You have 3 examples below showing the toes wrapping into the back of the image where the heel normally projects. In the middle, you have both hips wrapping into the image on the opposite side of the field of view, and then on the image to the right, you can see the front and back of the brain wrapping into the smaller field of view. Some remedies or compensations for wraparound artifact. You could simply increase the field of view to cover all the anatomy. With this option, unfortunately, you decrease your spatial resolution. You can place a saturation band over areas outside the field of view to nullify signal from those structures. The disadvantage of doing this is you increase SAR because you're applying an extra RF pulse. You can increase no phase wrap, phase oversampling, or fold over suppression. These are all vendor-specific terms, but simply you're oversampling the data. You're allocating a pixel position for that signal that you're receiving, so it doesn't wrap into the image. You could swap the phase and frequency directions. This does not eliminate the artifact, but you can remove it from the region of interest. And always make sure you're selecting the smallest coil for the body structure and turn off unused coils. Truncation artifact, aka Gibbs. This is caused by undersampling of the data. Not enough lines of K-space are filled, so interfaces of high and low signal are incorrectly represented on the image. This occurs along the phase encoding direction because once again you're not filling enough lines of K-space or rows of K-space, which is associated with the phase encoding direction. I like to think of this artifact as when you're trying to fit a circular peg into a square hole. A lot of times when you're encoding the data in MRI, you're putting it into very squared off dimensions like K-space, your image matrix, your field of view. But what you're collecting are sine waves, which are radio frequency bands, which have this curved structure to it. So as you put this curved sine wave within the square peg per se, or image matrix, you get areas of high signal where you're supposed to get areas of low signal intensity. So you see this artifact commonly within the spinal cord as you go from high signal of the CSF to low signal of the spinal cord on a T2 weighted image. Truncation appears as rippling across the image at interfaces of high and low signal. So as you can see from the image to the right, you got high signal intensity from the CSF streaking through the low signal areas of the spinal cord, as well as on the axial brain where you have high signal intensity of the CSF that is surrounding the gray tissue within the brain, which is a lower signal intensity. And it creates this rippling artifact as you can see with the black arrows. Some remedies or compensation from truncation artifact. You can simply just increase your matrix, especially in the phase encoding direction. Make sure you're avoiding partial Fourier techniques, and you can utilize fat saturation to get rid of those high signal areas that would eventually streak across those low signal areas. Magnetic susceptibility artifact is caused by local magnetic field inhomogeneities introduced by the metal object into the otherwise homogeneous external magnetic field, B sub 0. This artifact occurs along both the phase and frequency direction. The appearance of this artifact is a combination of image distortion with large signal voids. Distortion is due to lines of flux becoming attracted to the ferromagnetic object and causing a corresponding nonlinearity of the gradients used in spatial encoding. Signal loss is caused by rapid dephasing at the interface of these tissues. Remedies or compensations for magnetic susceptibility artifact. You can simply just remove the metal, like in the case where a patient has metal dentures in their mouth. Utilize a turbo spin echo versus a gradient echo pulse sequence. A turbo spin echo has multiple 180-degree refocusing pulses, which helps compensate for inhomogeneities and metal artifact. If you're trying to nullify fat signal, you can use stir versus a fat-sat sequence. Stir is better for metal artifact because it's based on the relaxation rates of fat, versus a fat-sat sequence, which is based on the precessional frequency of fat, which could fluctuate if you have field inhomogeneities. You can use a wide receiver bandwidth, which helps to increase the signals that you're receiving and pretty much average out the metal artifact and reduce the size of that metal artifact. In the next three, you're basically increasing the spatial resolution by either increasing the matrix, decreasing the field of view, or using thinner slices. Having a higher spatial resolution will reduce the size of the artifact on the image. And finally, you can decrease the echo time, which will reduce the time that the signal has to decay and reduce the size of the artifact. Chemical shift artifact is caused by spatial misregistration of fat and water molecules due to the differences between resonant frequencies of fat and water. As a review, fat resonates at a slightly lower frequency than water. This is due to it being a large molecule that has a slower tumbling rate than water. Water is also polar, which makes it more magnetically susceptible, which causes it to have a higher precessional frequency. Precessional frequency is calculated using the Larmor equation and is field strength dependent because the static magnetic field is incorporated into the Larmor equation. So as you can see from the image to the right, when you are scanning at a 1.5 Tesla magnet, the chemical shift between fat and water is 220 Hertz. But as you increase it to a 3 Tesla magnet, that chemical shift increases to 440 Hertz. This artifact occurs along the frequency direction because we're talking about precessional frequencies of fat and water, and it's also occurring as you're collecting the signal with your receiving coil. The appearance of chemical shift artifact is dark and bright bands on either side of the structure where fat and water interface. It is most likely present on an axial image of the abdomen, where you can see on the kidney you have a dark band on the medial aspect of the kidney and a hyperintensity bright band on the lateral aspect of the kidney. Remedies or compensations for chemical shift artifact. You could simply scan at a lower field strength, where the chemical shift between fat and water are not as pronounced. You can increase the receiver bandwidth, which will increase the pixel frequency range so that fat and water appear next to each other on the image. Image to the right showing a receiver bandwidth of 32,000 Hertz, and that increases the pixel frequency range to 125 Hertz. So with a chemical shift of 220 Hertz, fat and water are placed next to each other on the image. As opposed to a receiver bandwidth of only 16,000, the pixel frequency range is 62.5 Hertz, and the difference there is 3 or 4 pixels apart between fat and water. And finally, you can simply just utilize a fat or water saturation method to reduce the signal from one of those tissues. Chemical misregistration artifact, aka out of phase artifact, or black boundary, or India ink artifact. Once again, this artifact is caused by the difference in precessional frequencies between fat and water. The image to the right really hones in what is going on in this artifact, where you have fat and water precessing at different rates, and at times they are in phase, which means that they are at the same point along the precessional path. But at other echo times, they're out of phase, so they could be pointing in different directions along that precessional path. This artifact occurs in both the phase and frequency direction. The appearance of this artifact is a ring of dark signal around organs where fat and water interfaces occur within the same voxel. So you can see how it gets its name black boundary or India ink artifact, as there is a black highlighter around most major organs. Remedies or compensations for this artifact. Even echo rephasing, where you're using multiples of 4.2 milliseconds for TE at a 1.5 Tesla magnet. As you can see here, you're collecting 2 sine waves where water and fat are precessing at different rates. And at TE of 2.1, fat and water are out of phase, but then they rephase and come back together at 4.2 milliseconds. Utilize a turbospin echo pulse sequence rather than a gradient echo pulse sequence. A turbospin echo uses multiple 180-degree refocusing pulses, which bumps the signal of fat back up to be almost equivalent to the signal of water, so that it appears as almost the same signal intensities on a T2 weighted image. Utilize a Dixon technique, which can provide fat-only or water-only images. This is also sometimes referred to as in an opposed phase, which is very common in an abdomen scan where you're trying to diagnose a fatty liver or fatty adrenal glands. So sometimes you use artifacts to help diagnose certain pathologies. Crosstalk artifact is caused by loss of signal seen in an image from a multi-angle and multi-slice acquisition. This is when two slices physically intersect. Hydrogen spins receive two RF excitation pulses from two different slices, which completely saturate the tissues at that intersection. So think about it again as the tissues in that area will receive one 90-degree excitation pulse, which is good because that puts you on the transverse plane. But then it receives another 90-degree excitation pulse immediately, and it will knock it 180 degrees from its starting point, which is considered complete saturation, which will nullify the signal of those tissues. This artifact is seen in the slice select direction. The appearance of this artifact is a band of signal loss where the slices overlap. You can see this artifact streaking across the image through the spinal canal, which is not good when you're trying to image the spine in the axial plane. Remedies or compensations for crosstalk artifact. There really are no remedies or compensation, simply just do not overlap the slices or have the slices intersect. Make sure you're angling the slices, and if they do intersect slightly, make sure it's not within the region of interest. Sometimes as you're setting up axial slices for the L spine, where you have a very large curvature at the L5-S1 junction, most technologists usually use a two-step process of acquiring the slices. Cross-excitation artifact. This is caused by RF pulses that are not exactly square, which can result in nuclei in nearby slices becoming excited at the improper time. The ideal slice profile would be squared off, as you see in the image to the right, where the slices don't bleed into each other. The actual slice profiles, however, are more sine wave oriented, where you can see that they start to bleed into each other at the bottom, and this is the cross-excitation. These neighboring nuclei will become more saturated, which will reduce the overall SNR, which affects the image contrast as well. This artifact occurs along the slice select direction. This artifact presents as adjacent slices having reduced contrast and/or signal. You can see on these T2 axial brain sequences where you have normal image quality showing the difference between the white and gray matter, and the overall image signal is higher than the images with cross-excitation, where the white and gray matter do not have much contrast difference, and the overall signal has been reduced. Remedies or compensations for cross-excitation artifact. You can activate interleaving or concatenation, which is acquiring slices in this interleave fashion where you acquire slice 1, 3, 5, and then go back and fill in slice 2, 4, and 6. However, the negative aspect of this is it increases your overall scan time. You can increase the slice gap where you don't get this cross-excitation overlap, and most acquisitions have about a 10 to 20% slice gap to prevent this artifact from occurring. However, the downside to this is that you potentially could miss a small metastatic lesion in the brain that was in between the slice profiles. Moiré or zebra artifact. This is caused by a combination of wrap artifact and field inhomogeneity when acquiring a gradient echo image using the body coil. This artifact occurs in the phase and frequency direction. This artifact appears as black and white bands at the edges or fringes of the field of view. So you can see how it gets its name, zebra artifact. This occurs with gradient echo pulse sequences with large fields of view. Remedies or compensations for Moiré or zebra artifact. You can utilize a spin echo pulse sequence versus a gradient echo. We know that spin echo pulse sequences give you better image quality because they have 180-degree refocusing pulses, which help correct for field inhomogeneities. But for this purpose, sometimes you just need a quick gradient echo coronal image of the abdomen to set up your axial slices. And sometimes it's okay having this artifact on the fringes of the field of view. You can manually shim the magnet to make the field as homogeneous as possible and increase the node phase wrap to prevent that wrapping artifact to occur in the first place. And make sure you're using a smaller field of view. This will help prevent inhomogeneities towards the edges of a very large field of view. So sometimes when you're acquiring images of large anatomy like the femur or the tib fib, you can break it up into sections instead of using a very large field of view. Magic angle artifact. When tightly bound collagen water molecules lie at 55 degrees from the static magnetic field B sub 0, these tissues will appear hyperintense and can be potentially mistaken for tendinopathy. Normally, tendons, which are tightly bound collagen, water molecules are restricted, usually causing very short T2 times, accounting for the lack of signal in these structures most of the time. This occurs commonly on sequences with short TEs, like a T1 proton density or even a gradient echo pulse sequence. This artifact occurs along the phase and frequency direction. The appearance of this artifact is an increase in signal intensity in collagen-containing structures. Some typical sites include the proximal part of the PCL, the infrapatellar tendon at the tibial insertion, perineal tendons as they hook around the lateral malleolus, cartilage near the femoral condyles, supraspinatus tendon, and the triangular fibrocartilage complex. Remedies or compensations for magic angle artifact. You can increase the TE because once again these artifacts occur with very short TE times. Select sequences with longer TEs, like a T2 weighted sequence, or simply just reposition the anatomy of interest, because if this artifact occurs, you are extremely unlucky in the first place. Zipper artifact is caused by external radiofrequency signals contaminating received imaging data. This is when the RF shielding is compromised, or the Faraday cage, that is copper, surrounding the room is compromised. These external RF signals can be coming from radio towers or equipment in Zone 3 that are leaking into the room. This artifact occurs along the frequency direction because it's when we are receiving the signal. The appearance of this artifact is black and white zipper bands at right angles to the frequency encoding direction. Remedies or compensations for zipper artifact. Make sure the MR scanner room door is shut during imaging. Some technologists like to go in the room to grab certain equipment or IV materials. Try and prevent that while you're imaging to prevent this artifact. Remove all electronic devices from Zone 3 and Zone 4 because those could be emitting a signal that is interfering with the imaging data. Common spots where RF shielding is compromised: the scanner room door. These copper teeth tend to wear down and break off as you use the door more and more. Or the penetration panel where the cables enter the room. Make sure you have copper lining around that penetration panel. Shading artifact is caused by uneven excitation of nuclei within the field due to RF pulses being applied at flip angles other than 90 degrees and 180 degrees. This results from abnormal loading of the coil or coupling of a coil at a point, as with a large patient whom touches one side of the magnet or one side of the coil. Inhomogeneity in the magnetic field also causes this shading artifact and or overflow of analog to digital converter. This artifact appears along the phase and frequency direction. The appearance of this artifact is dark spots across the imaging volume. Remedies or compensations for shading artifact. Load the coil correctly so that it is evenly distributed over the body part. Make sure if you're using two body coils that they're synced together nicely so that they're evenly distributed over the body part. Use the proper size coil for the patient's size and the examined body part. Prevent the patient touching the coil. You can use foam pads between the patient and the coil, making sure you shim to reduce inhomogeneity of the magnetic field, and then use the proper scanning parameters to set proper amplitude of applied RF pulses. Partial volume artifact. This occurs when many different tissues are averaged into one voxel. This is due to low spatial resolution. With the image to the right, you can see a voxel with 3 tissues. They all have different Hounsfield units associated with them. With a very large voxel, all those tissues get averaged together, and the number corresponds to the average of those 3 tissue numbers. This spits out 1 shade of gray, which is an issue because that could hide a smaller pathology within that voxel that had its own Hounsfield unit associated with it. This relates to MRI because each tissue has its own relaxation rate, and if you have 3 tissues within a voxel, they have all different shades of gray. But if you have a very large voxel, what happens is it gets averaged together and only 1 shade of gray gets spit out from that voxel, which could hide a very small pathology like a metastatic lesion within the brain. This artifact occurs along the slice select direction. The appearance of this artifact is unsharp or blurry images due to the low spatial resolution. Remedies or compensation for partial volume artifact. Reduce the slice thickness, that increases your spatial resolution. You can also increase the imaging matrix. Once again, that increases your spatial resolution. And you can decrease the pixel and or voxel size. And once again, that increases your spatial resolution. Herringbone or corduroy artifact. This is caused by malfunction of coils or other equipment, like the fluctuation of the power supply and or RF pulse discrepancies. It can also be caused by electromagnetic spikes in noise caused by gradient coils or external forces. This may be equipment in the MR scanner room, or issues when converting our K-space into the image through the fast Fourier transform due to one or few aberrant data points in K-space. This artifact occurs along the slice select direction. The appearance of herringbone or corduroy artifact is regularly spaced stripes that resemble the appearance of a fabric with a herringbone or corduroy pattern. Remedies or compensations. Check the equipment. Simply just repeat the sequence, and or call an engineer. In summary, this lecture explained causes, appearances, and remedies or compensations for common MRI artifacts seen in the clinical setting.